My name is Allison Sansom. I currently serve as the Dean of Nursing, Science, Health Sciences, which include EMT, Health Information Management, Laboratory Technician, and my newest program, which is cosmetology. And so I'm here today to talk to you a little bit about health occupations, even though cosmetology is not really a health occupation. It's a strange reason that I won't bore you with why that's one of my programs. I've been a registered nurse for 30 years. In 2012, I was asked to apply for a position as a faculty member at Clatsop Community College, and I decided at that time I would leave healthcare administration and become a nursing program faculty member. And about 2 years after that, I was promoted to the director of nursing. 3.5 years ago, I came to Klamath Falls in order to take the position that I currently have as the Dean of Nursing, Health, and Science. And so that's what I do here on the KCC campus. We're going to talk a little bit today about health occupations. So before, and I already gave you sort of a hint, but before we get going, can anybody tell me what you think about when you think about health occupation? What kind of a career? Right? You can't say nursing because I already told you nursing. Medical assistant, that's a great one. Yes, medical assistant is also a health occupation.
X-ray technician.
X-ray technician, perfect. Yep, diagnostic imaging, whether that's ultrasound or MRI CAT scan or X-ray. So there are certain programs, individual programs. What else?
Phlebotomy.
Phlebotomy, another great one, sometimes taught right along with medical assisting and sometimes taught separate. What else? Health occupation.
Physical therapy.
Perfect. Physical therapy, right? In addition, there are occupational therapists, also a health occupation, and speech therapist, health occupation, and each one of those also have assistants they work with. So physical therapy assisting, occupational therapy assisting. What else? What other kind of health occupations are there out there? Who do you see every year when you have health insurance? Dentist, dental hygiene, dental assisting. What else? Doctors, right, doctors, nurse practitioners, physician's assistants, right? All of those are health occupations. So we're going to talk a little bit more about those health occupations, okay? One of the things that they have in common, all of those things that we've talked about, dentists, doctors, medical assisting, nurses, are that workers in these occupations help clients maintain and improve well-being, as do cosmetologists, but that's still not why cosmetology is part of my programs, right? Workers in these occupations help clients maintain and improve well-being, right? So hopefully we don't wait until people get sick in order to deliver care for them, but if they are, then we help them improve their well-being, okay? So if you're kind of a person who likes to help others, who likes to help others feel better, who likes to help others reach their full potential, or to stay well, or to be concerned about their health, then you might be interested in becoming a health occupations worker, all right? So you'll see in our little icon here, blood drops, right? Those are phlebotomists that do that. Laboratory technician, we didn't talk about, but oftentimes phlebotomists work in the lab, and sometimes laboratory technicians need to be phlebotomists as well. And then obviously our heart is involved in the work that we do, right? We care for patients, and whether that's physical care or that's heart care, that's what we do as a healthcare worker. If you want a job, if you want an occupation where you can find a job, no matter where you live, no matter where you want to work, you can find one in health occupations. Health occupations are projected to grow another 13% in the next 10 years, all right? So in addition to replacing people who are retiring, we're expecting the healthcare workers to grow by 13%, which means in the next 10 years there will be 2 million more jobs to fill, over the next decade. And if you total that with the number of people who are retiring or leaving the profession, that means close to 2 million openings every year. So jobs, 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 and more jobs, right? You could go to any healthcare entity and they will have jobs available right now. Any healthcare entity, I would challenge you to find a healthcare entity right now, whether it's a hospital or a clinic, that doesn't have some sort of a job opening. We are chronically understaffed, particularly post-pandemic, which is very difficult on healthcare providers, regardless how you felt about the vaccine, regardless how you felt about masks, regardless how you felt about being shut down. Our healthcare workforce was overwhelmed. So no matter how I felt personally about any of those things, what I cared about were my colleagues and my students being overwhelmed during the last 3 years, which has precipitated a large number of people leaving. Not because it was stressful caring for sick people, because that's what we do, but we literally had no beds left, right? So we never had a short or an easy shift because our hospitals have been inundated. I will tell you right now, with elective surgeries, they are up at Sky Lakes. If you have a surgery scheduled, they're not sure if they can do it right now because their beds are all full, right? That's not just COVID, but we've got a lot of influenza A happening right now. We have COVID still happening, as well as RSV, which is a really difficult respiratory infection for our little ones, okay? So we have, in the next 10 years, every year we're going to need to fill almost 2 million jobs nationwide. That's just in our nation. All right. So if you're looking for a job, you're looking for someplace that you can put your effort in your education because you're looking for a job with benefits. Healthcare might be it for you, particularly if you're one of those people who like to care for and about people and who like to make people feel better or reach their full potential. So how do you get one of those jobs, right? There are certificate programs. There are programs that require an associate degree. That's pretty much what we offer here, certificates and associate degree. And then, of course, there are those healthcare occupations that require a bachelor's degree, maybe a master's degree, maybe a doctorate, and some other requirements like a residency. All right, so let's talk about those that you can get with a certificate, right? I think you brought up phlebotomist. You can get a phlebotomy certificate when you're done with your GED in 1 term, 3 months. You can get your phlebotomy certificate. They need phlebotomists at Sky Lakes in the worst way right now. I just got an email from them last week that said, when is your next phlebotomy program? We are hurting for phlebotomists. We offer a phlebotomy program. The little ones with a little asterisk after them are the ones that you can get right here at KCC. So we offer a phlebotomy program through community education. We're offering one this term. It's already started, but we offer them every year. The next one with their certificate is a certified nursing assistant. How many of you would like to get paid while you're taking your certified nursing assistant class? That's what the hospital is doing right now. That is how short of CNAs they are right now, that they will pay you to sit in class and take your class. They will pay you to do your clinical time and to test. We offer a certified nursing assistant class every term here at KCC, and we also put on the class for Sky Lakes and Lake District Hospital. The classes that they run where they pay you to take it, I don't pay you to take my class, right? But if you have been hired by Sky Lakes or Lake District Hospital to take the CNA class, we provide that class for you, but they will pay you to take that class, right? They will pay you to do your clinicals. Oftentimes, these programs have a classroom portion as well as a practical portion, which means it's hands-on, right? You come into our labs and we teach you these skills and you get to perform them on each other or a high-fidelity mannequin or low-fidelity mannequin or an arm that bleeds, right, if you're going to be looking for blood. So we have some pretty fancy labs for you. The next one is medical assisting. Medical assisting takes you 2 terms, 6 months. What's this little asterisk mean?
You can get it at KCC.
You can get it at KCC. So oftentimes phlebotomy is married to medical assisting. So where do medical assistants work for the most part? Where?
Clinics.
Clinics. Remember when we were all young, some of you look pretty young. Remember when we were young, you used to go to the doctor and the nurse would take your blood? Well, the nurse doesn't work in clinics anymore. We make too much money. They hire medical assistants now to work in clinics. You know the best thing about working in a clinic? Banker's hours, Monday through Friday, 9 to 5, lunch off, right? I think right now certified nursing assistants, medical assistants make about $15 an hour, right? $15 an hour plus benefits, generally paid time off. If you don't know what benefits cost, you can actually just add about $600 to $800 a month to what your paycheck is. That's what it costs your employer to give you health care benefits. So when you're looking at $15 an hour, which may sound decent, may not sound decent, and that's starting pay, you usually get a step increase, add about $800 to that a month, because that's really what your employer is paying you, okay? How about a pharmacy technician? Anybody ever heard of a pharmacy technician? You were a pharmacy technician? Oh, your auntie is. And what does she do?
She's a pharmacist.
And what does she do in that role?
She gives us medication and also gets us to the pharmacy to let us know how to take the medicine.
That's right. They work with pharmacists, and they work in a pharmacy, and they take your prescription, and they're usually the ones who fill it, right? And then the pharmacist checks their work, and then they can give the medication to the patient, dispense it to the patient. And sometimes they answer questions. Sometimes the pharmacist comes and answers questions. And again, what's the asterisk mean? You can take it here. We offer pharmacy technician through our community ed. The next one I'm going to talk about is licensed practical nurse. What's the difference between a registered nurse and a licensed practical nurse? Anybody know?
Practitioner.
Well, a nurse practitioner would be over here under the bachelor's degree. So certificate. So licensed practical nurses have a supervised practice, which means they work under the RN, right? They cannot provide or complete a comprehensive plan of care. That's the job of the registered nurse. So while they may not work right next to each other, an LPN has a supervised practice where a nurse does not have a supervised practice, okay? Physicians do not supervise nurses. That's a common misconception, right? Physicians have to give us orders that we follow, but we do not work supervised by. If you work at Sky Lakes as a CNA, they may decide to train you as an EKG monitor technician. Okay, so you monitor the EKGs. Usually you have to have your foot in the door. Emergency medical technician should have an asterisk there. Okay, we offer that over on the academic side. Certified alcohol and drug counselor, CADC1, also part of our criminal justice ADS program at KCC. Medical receptionist, we offer that through our health information management program. So if you're a caring person and you want to be involved in healthcare, but you don't like blood and guts and snot and some of those things that some people are adverse to, we call this working in healthcare without the yuck. Okay? Medical receptionist, billing and coding. All of those things you can do in 1 to 2 terms after you complete your GED, right here at KCC, unless there's not an asterisk there. All right? And then moving on to an associate degree, you can see there we offer registered nursing. We are working on a surgical tech program. We're hoping to have that up and going by 2024. We talked about some of those physical occupational therapy assistants. So physical therapy assistant is to a physical therapist what an LPN is to a registered nurse. All right? The physical therapist develops the comprehensive plan of care, and the PTA or the OTA assistant actually work with the client and implement that plan of care. So you work hand in hand with physical therapy. A medical records specialist, again, it comes back to our health information management. Paramedicine, once you become an EMT, then you might want to become a paramedic. We offer that in partnership with RCC, Rogue Community College. And then laboratory technician. All right, then we get over to these ones that take a lot of schooling. All right, you can be a bachelor's prepared registered nurse. We all take the same board test. Doesn't matter if you're a bachelor prepared or associate's prepared. We all can become registered nurses. Then we look at the nurse practitioner, which is a registered nurse who then goes on and gets additional care, usually a master's or a doctoral degree. And then you can see some of our therapy, our therapists, our pharmacists, a physician's assistant, medical doctor, psychiatrist, mental health counselor. Those are all bachelor's degrees or higher. Okay? You guys have an understanding of the education now required to be a healthcare worker? It can be extensive. It can be pretty short. Depends on what you want to learn and how you want to enter the workforce. So how do you get into these programs, right? Sounds like a good deal, right? 3 months, I get a job. So there are various ways that you enter healthcare programs, and pretty much they boil down to 2 separate ways to go. You can do direct entry, which is you get done with your GED, you go over to student affairs or student services, you register for the next class. Okay, direct entry. Very minimal prerequisite sort of requirements. Does everybody know prerequisite, what that term means? Prerequisite, it can mean a course, which means a prerequisite course before you can get into a program, or prerequisite requirements before you can get in. So some prerequisite requirements of direct entry might include vaccines, okay? Measles, mumps, rubella, hepatitis, hepatitis B vaccine. There's not a vaccine for hepatitis C. A hepatitis B, which is bloodborne, tetanus, diphtheria, pertussis, varicella. Who knows what the layman's term for varicella is? Anybody? Some of you probably had it, and some of you probably got a vaccine. Depends on how old you are.
I think I had COVID.
Nope.
The smallpox?
Close. Chicken pox, right?
Yeah.
Those of us who are my age, there wasn't a vaccine when we were young, so we all got chicken pox. And when you heard that there was a kid who had chicken pox, all the moms took the kids over there, got them chicken pox party, so we all got chicken pox at the same time. Then we'll never get it again. All right? Those of you who are younger, you got a vaccine when you were a kid, you'll never have chicken pox. Okay? So varicella, those are the kind of vaccines. Now, I will tell you the state of Oregon does not require right now that our students have COVID vaccine. However, most of our healthcare entities where you will work or do your clinicals do. Okay? And so if you are adverse to getting the COVID vaccine, you may or may not be supported in that, okay, by our clinical facilities. Some of our clinical facilities do allow a religious exemption, right? That's the only way we can get out of vaccines if you're a healthcare student in the state of Oregon, okay? Religious exemption or a medical exemption. They also prerequisite or part of the program are going to want you to have cardiopulmonary resuscitation training, which is just a good idea to have anyway in case you come upon somebody without a heartbeat. We're also going to conduct a drug screen, right? These are standards for health occupation students. It is a 10-panel drug screen, which means marijuana is included, okay? That is because we have to comply with federal guidelines, and you may or may not know several states have allowed for recreational and medicinal use, but the federal government still classifies marijuana as an illegal substance, so we do have to have a clean drug screen. And then last, oftentimes we have to do a background check because we are having you work with vulnerable population. So we need to make sure that you're not going to jeopardize vulnerable population. So does that mean you can never have been arrested? How about, does it exclude people who have a felony?
Yes.
Yes.
Not necessarily.
Uh-oh.
Not necessarily, okay? We tend to look at people's criminal history on a case-by-case basis. All right? You would be surprised at the relatively small list of crimes on the Board of Nursing's website that would disqualify a nurse from becoming a registered nurse. Small list, right? So what we want to look at was, how old were you when you committed the crime? Were you 18 and now you're 36? What's the likelihood of reoffending? What was the nature of the crime? Did you shoplift baby diapers? Right? Or did you break and enter and assault somebody in their house? Big difference. Did you comply with the requirements from your conviction? If you got a DUI, the judge said you have to go to drug and alcohol counseling. We're going to look to make sure that you completed that counseling, right? We're going to drug test you, see if you're clean now, right? So don't assume that if you have a prior criminal background that you are automatically excluded. It's not true. Now, depending upon the nature of the crime, the more severe crime, the less amount of time between conviction and today, whether or not you completed the requirements of your conviction, those are the things that we look at, okay? And like I said, you'd be surprised at the list of automatic disqualification. The Board of Nursing also understands that not everybody always made the best decisions when we were young, okay? So don't just automatically assume that you're out because you made a stupid mistake when you were 19 years old, okay? Your program director is going to work with you. When you apply for licensure, if there is a state licensure, those boards will also use the same process. We call that a weighing test. We're weighing what potential of harm you are to a vulnerable population. And if it's been 20 years since your conviction and you've been a fine, upstanding citizen and you're getting your life together and you're trying to better yourself, people are going to see that and make a decision in favor, okay? Now, one thing we won't tend to do is if we don't think the board that's going to license you, if there is a board, they have to make the same decision when you go to license, okay? So we try to use the same lens when we're looking at our students. Is this something that the Board of Nursing is going to allow? Now, if we go back, I can tell you right off the bat that some things don't have boards. For instance, a medical assistant. There's no board of medical assisting in the state of Oregon, or in the United States for that matter. There's no scope of practice, and there's nobody that decides whether or not you get to be a state licensed medical assistant. Different for certified nursing assistant, different for nursing, right? There's not a state board of EKG or ECG monitor techs, okay? So some of these have state boards. Generally, those over there, more state board regulation than these ones over here. Make sense? Yes, sir.
Is a forensic study following health like you see on television, like CSI?
It would actually fall more under criminology, right? But we have lab tech. We have 2 kinds of lab tech programs here at KCC. We have one of those that falls under criminology, and we have a lab tech program that falls under healthcare. So it depends on your specialization. They're both called lab techs. One's a healthcare lab tech, one is a criminology lab tech. And we offer both of those programs here at KCC.
Do you know that like you can't be in law enforcement if you have a DUI or 2 DUIs or something? Would that also be for the criminal?
That I don't know.
Oh,
Yeah, I don't have that answer for you. You know who might have that answer? Elazar Gutierrez, who is our lab tech program faculty. His office is over in Building 6. Elazar loves to meet with students, especially if he thinks you might be interested in his lab tech program. Okay? On the outside of his door should be his office hours where you can find him in his office. You don't even need to make an appointment. All right, let's move back to the slide we were on. All right, so you understand direct entry now. Let's talk about restricted entry, because we have a few restricted entry programs at KCC, one of which is nursing, LPN, registered nurse, okay? So there are prerequisite courses, which means you have to complete some courses before you can apply to come into the nursing program, all right? There's a total of 45 academic credits. We let you apply when you have about 30 of them done. Most restricted entry are very competitive, selective processes. I have 50 applicants every year for 8 spots, right? I'm going to choose the 8 students I think that have the best chance at making it through a rigorous program and who will be assets to our healthcare profession, okay? And we have a process, a very detailed process for how I select those 8 people. I don't just meet with them and say, you know what, I like you, I like you, I like you, and I like you. All the rest of you I don't like, right? That's not how it works. We look at your GPA, so your grade point average on your prerequisite courses. So if you're interested in going into a restricted entry program, from day 1, you need to pay attention to your grade point average, okay? Because I'm going to be comparing that with 50 other people and trying to decide who's going to be able to make it through this difficult nursing program. Oftentimes we look at related work experience, and you see why it might be advantageous to be a CNA first before applying to the nursing program, right? Because if you've been in the field and you're doing good in the field, then I'm going to give you some related points. It might include written essays, interviews, entrance exams. Your grades in science in particular are super important in healthcare occupations, and various other things. I also look at foreign language fluency. I give extra points for people who are fluent in more than one language, right? So healthcare programs are usually direct entry or restricted entry. So before you get like, oh, I'm going to be a nurse, figure out what it is that you have to do to get into that program, okay? And sometimes it's great to start at the ground level. How can I get my foot in the door? I have had students make it into nursing, never done healthcare before, tell me after 2 weeks, like, I don't know what I thought nurses did, but it wasn't this. I don't want to be in your program, right? So it's a really good idea if you're going to do a lot of effort to get into a program, you have some semblance of an idea if it's a program that's going to work for you, that you're going to like, okay? But these direct entry, this is a great place to decide that. I don't know if I like taking care of people. I'm going to be a medical assistant and see if I like working in a clinic and that kind of work, right? I don't know, maybe blood bothers me. Maybe I should see about being a phlebotomist, right? And see if I can make it through class and draw people's blood and see blood, okay? 1 or 2 terms, not a huge time commitment. But once you're in there, it's going to be a time commitment. None of these programs are easy. We take care of people. We have human lives in our hands. And so it's going to be serious. Any question about the healthcare education programs and entry and how you get into them? Okay, what are your next steps now that I got you all jazzed about being healthcare workers? First thing you need to do as a student of KCC is meet with our career counselor, Michelle Horn. I'm going to give every one of you her card. She's over in building 4, okay? All you have to say is, I'm a current student, get my GED. I want to meet with you and find out what my interests really are. She'll give you some exams. It won't be like for grades. They'll be fun to take. It's called a career assessment, okay? She's going to assess your aptitude and your interests. Then you should establish a goal with Michelle. Michelle will follow you through the rest of your journey at KCC and be in your back pocket to help you out, okay? Once you complete this program here, you decide what your goal is after you've taken your career assessment. Say, you know what, maybe I want to be a medical assistant. That's what I want to do. I want to be a medical assistant. You're going to stay in regular contact with Michelle, right? Because she's your key to success. She's going to help you every step of the way. You're going to complete your GED because that's the first step in moving beyond, right? So you're going to keep at it, get your GED. Then somebody, if it's not Michelle, she'll hook you up, can help you submit your FAFSA, right? That's your federal financial aid application to see if there are money available to help you with your goals. Then you're going to enroll in a program or start your restricted entry process, like start your prerequisite courses. You're going to complete or prepare to meet your admissions requirements. So for one thing, you're going to want to make sure that when you get admitted and the program director says, I need for you to submit a urine sample, that urine sample is going to be clear, right? Those are your next steps in becoming a health occupations worker. And if you don't know, the other thing that's going to help you along the way are all of the support services that we have available at KCC. We have a benefits navigator, which means if you go to her and you say, I can't pay my heat bill this week, I got to drop out of class because I need to get a job because I got to pay for my electric bill. They're going to try to help you find a voucher for that electric bill or figure out how they can get you a job that's going to work around your college schedule, all right? We have a food pantry. You can get 2 bags of groceries every month. We have a career services center, right? That's where Michelle works. We have a full-time mental health counselor on our campus, right? If you need help with figuring out how to handle stress because you are putting more stress on yourself to get a job, they're going to help you with those tools, right? You don't have to be in a crisis to see our mental health counselor. It might be something that you just want to regularly schedule, right? Because you have more stress in your life right now because you're trying to better yourself with education. They'll help you with those tools. We have a TRIO program, which is for first generation, meaning your folks didn't go to college or low income. We have tutors available. We have a wonderful librarian who will sit with you and help you with your coursework. We have a disability services coordinator. So if you have ADHD and you have a hard time sitting in class and paying attention without getting up and moving, she will help you get an accommodation in class. If you need more testing time or you need a quiet environment, we'll provide that for you. If you need somebody or a tool that will take notes for you, they will provide that. So if you have a disability, you see the disability services coordinator, we will accommodate your needs in the classroom. Faculty advising and office hours, just like I said, go see Elazar Gutierrez, right? On his door will be a posting of his office hours when you can just drop into his office. We also have a robust student life and student clubs that help keep you connected, right? Help you find other students who have similar interests. And then the academic advising by student affairs, right? So many hands to help you be successful. You are not at this alone, right? It's almost difficult to fail at KCC as long as you show up and you do the work. You show up and do the work, we're going to help you get through, right? If you don't show up and do the work, there's not a lot we can do. You show up and do the work, it's hard to fail at KCC. Each one of you in here has the capacity to do this. Okay? You've already taken the first step. Right? You came to KCC to get your GED. Maybe some of you, just because that was your personal goal. Maybe for some of you, it was to get a different job or a better job. No matter what it was, we'll help you do that. And if it was to get a better job and you're looking for, where can I move anywhere? Like, where's your best place to move? I want to live in San Diego because it's 75 degrees all the time and it's sunny. You can find a job there as a healthcare worker. I don't care where you want to go in the United States. You will find a job there with benefits as a healthcare worker.